I was really drawn to endocrinology more because I really liked the objective nature of the specialty. So, most things are in the biochemistry, and they never lie, the lab results. It's multifaceted. It affects a number of different organs, and I really liked that about the specialty, how it was the whole body and not just focused on one particular thing. The first visit is really important to kind of establish what my goals are, but more importantly, what the patient's goals are and what their understanding is of why they're there. So I like to spend the first few minutes really speaking to the patient about what their understanding is of why they're seeing me. Sometimes they know and sometimes they don't know, and that's a really good starting point because we can then, first and foremost, have a conversation about why they're there and what they can expect. And I also like to know a little bit about themselves, what their health values are, and what they're looking to get out of an appointment. And we're there to kind of guide those decisions, provide the evidence for and against different treatment options. But I'd like to give them all the options, including the option of doing nothing, and what they can expect if they do choose that option. That way they're making a really well-informed decision and a decision that fits well with the patient. I always think, if I was a patient, what would I want to know? What would what would some of my concerns be? And I want to really be felt that I was heard, and then really make a decision with my doctor that I felt was taking my values and my best interests into play in that decision. Patients, for the most part, are vulnerable. They're really trusting you with a lot of their care. It really gives me a sense of satisfaction when patients feel like they are in good hands. And, when you feel like you have done them justice and you have really, with all the knowledge you have and all the knowledge that is available, come to the best decision for them. If at the end of the day I can go back home and say, look, I really kind of did the best I could, and we worked together for the best outcome, then I think that's satisfying.